is, sounds like the mic's live. The phone line is live. Okay, but it's ready to go. Or
It is.
you're ready. Okay. Okay. Okay, so it's just about noon. We'll get started. I'm Steve Buick, the press secretary to Tyler Shandro, the Minister of Health. Minister's here with several officials from the department. As usual, he may call on any of the officials to supplement an answer if that's necessary. So I think we're ready to go. Minister, I'll ask you to get going.
Thanks, Steve. And thank you, and good afternoon, everyone. I'm pleased to be here to give you an overview of Bill 46, the Health Statutes Amendment Act, and how Alberta's government is continuing to modernize health legislation to improve health services for Albertans. I'll be introducing Bill 46 in the legislature this afternoon. The bill proposes amendments to 4 pieces of legislation: the Health Professions Act, the Health Information Act, the Health Facilities Act, and as well the ABC Benefits Corporation Act. These proposed changes will make the health system more efficient, strengthen protections for patients, and use electronic health information in a more meaningful way to improve patient care and to improve outcomes. Now, let me take a moment to go through the proposed amendments for you. First, we would like to strengthen protections for Albertans by amending the Health Professions Act. This would establish the regulation of healthcare aides as a separate profession within the College of Licensed Practical Nurses of Alberta. This gives them a stronger voice in the health system, and it ensures that healthcare aides are held to the same standards of practice and expectations as other health professionals. The proposed amendments would also clarify the roles of colleges and professional associations by requiring that they operate separately of each other. This would ensure that regulatory colleges always put the public interest first by focusing on protecting patients. Professional associations would focus on supporting the interests and the priorities of their members and furthering that particular profession. I want to just clarify, this does not affect most professions because their regulatory colleges are already separate. Remembering that we have 29 of them right now in the province. Only 6 of them don't have the professional associations and their colleges separated. So as an example, here in Alberta, the College of Physicians and Services is the regulator. They're not an association. The Alberta Medical Association, or the AMA, they are the association, and it has the legitimate advocacy role. Its role is up to its members. So the physician's profession is a perfect example of that separation between the colleges and the professional association. Inevitably, there is some crossover. At present, there are 2 CPA council members who are also section heads for the AMA. They're not senior officers of the AMA, so it's within the CPSA's policies, and I'm confident that the college and the members of the council can manage their roles responsibly. The Health Professions Act amendments would also allow for the regulation of multiple professions within a single college. Potential amalgamation would support more effective and efficient governance and interprofessional collaboration. It would also allow some smaller professions to get the benefits that larger professions with a larger number of members have, like access to professional development. And it could save money on administration, which would benefit members of that profession. The proposed changes also allow for the creation of a central online public registry where Albertans would be able to search for a health provider rather than having to search multiple websites for multiple different colleges. Such a registry would help improve access to primary care. Other proposed changes include some housekeeping items, such as authorizing the performance of restricted activities through government regulation so that health professionals can work to the full scope of their practice, moving the provisions for restricted activities from the Government Organization Act into the Health Professions Act under a single regulation. Another example is amending the common provisions of the Health Professions Act to address matters that are currently addressed in separate regulations for different health professions. Another example is enabling colleges to manage their continuing competence programs through standards of practice. So these programs can be more responsive to new practices and health system changes. Another example is enabling colleges to address the use of professional titles in standards of practice so that they can assign titles in a timely manner to better protect the public. And then finally, providing for approval of professional regulations by the minister rather than the lieutenant governor and council. This would enable colleges and government to make changes faster, to be more responsive to changing needs, and more responsive to priorities. Now, Bill 46 would also amend the Health Information Act, allowing Alberta Health, AHS, and other custodians to use the Alberta Health electronic health record, or what we call NetCare here in Alberta, for a broader set of authorized purposes where there's a need. The change would support better patient outcomes by allowing authorized health organizations and health professionals to more efficiently share health information. Protecting the privacy of Albertans' health information is, and always will be, a priority for Alberta's government. Our obligation to safeguard patient health information under the Act will not change at all. The amendments would also, in fact, include tougher penalties for inappropriate access to a patient's health information, in addition to the existing requirement to report breaches of privacy. If these amendments are passed, the outdated Hospitals Act would be repealed, and all of the applicable parts would be copied and pasted into the Health Facilities Act. This change would ensure that there's one piece of legislation to govern how hospitals and other acute care facilities are run. The Health Facilities Act would continue to set expectations about how hospitals must operate to provide safe, high-quality care to patients and families. The legislation would better reflect the modern health system that we have today here in the province. We're also proposing a name change. If passed, the bill would change the name of the ABC Benefits Corporation Act to the Alberta Blue Cross Act. Now, this change would clarify the purpose of this legislation and to use the name that Albertans use for the organization on a day-to-day basis. And now, as I conclude, I just want to reiterate that these proposed amendments would increase the efficiency and the effectiveness of our health system here in Alberta. They would modernize health legislation by helping ensure that Albertans have access to high-quality, patient-centered health services in a more sustainable and effective way. And thank you very much. I'm happy to take any questions anybody might have for us.
Yeah, thanks, operator. I think we have reporters on the line, so put through the first, please.
Our first question comes from Janet French of CBC. Your line is open.
Hi there, Minister. Thanks for taking my question. I have another double header for you. First of all, I'm wondering, in the public-facing database where people will be able to look up health providers, why not include disciplinary information in that database where you could look up and see if somebody's license is suspended or revoked? My second question is this push to separate in professional regulation associations from regulatory bodies. Is this a sign of things to come with your movement with regards to the Alberta Teachers Association?
Well, I'll answer the second one first. I mean, this has nothing to do with this or with what you're suggesting. This was really, quite frankly, something that was raised with me by CARNA, the College for our Registered Nurses here in Alberta. They raised this issue back in 2019 with me, trying to point out that there are some colleges and associations that are the same entity, and it was something that's highlighted for me that was important for us to make sure that professional associations and colleges serve different purposes. One serves the interests of the public, one serves the interests of the profession, and so to make them separate was the request that I thought was quite thoughtful, and that's why we proceeded with this. The first the question that you had was related to the central registry. I'm happy to take that feedback. I think what we want to do, first of all, is to make it easier for patients to not have to look up. And, we have, as I said, 29 different colleges. And it's difficult for patients to always understand where providers might be in which these colleges. I think we are still working with the colleges to understand from them how we might be able to better make the complaint system in Alberta for the colleges more patient-centered. And I'm getting feedback from those colleges as we speak, and I'm looking forward to continuing to engage them on that. That's a question I'd be happy to put to them, but I would really want to get the advice of those colleges first before anything like that happened.
Thanks, Janet. You had a follow-up?
Oh, sure. I'm wondering about the healthcare aides. Is there anything specific about the way healthcare aides are operating right now, or is it that people have nowhere to complain about professional misconduct of healthcare aides? Like, why bring them under the banner of LPN regulation?
Well, I think it's quite frankly an evolution of the profession as they have progressed and become more and more important in our health system. It's just a natural evolution of them, and we want them to have a greater voice in the health system. So no, there's nothing that's happened that is instigating this. This is just really, quite frankly, an evolution of this profession. And we have a number of professions in the health system that are regulated, not regulated. Sometimes there are multiple professions within one college. For example, the College of Physicians and Surgeons also is the regulator for physician assistants and osteopaths, as an example. There's a college that also regulates podiatrists as well as the podiatric surgeons. So this is common to have more than one profession within a college, and we see this as a wonderful example of this important profession evolving in the health system here in Alberta.
Thanks, Janet. We'll go to the next question, please.
Our next question comes from Ashley Joanno of Post Media. Your line is open.
Hi, good afternoon. If I understand correctly, the changes you're proposing would prevent senior union and association members from holding positions that govern those professions. I'm hoping you can explain a little bit about what the motivation is, and also if you could talk about why this should apply to elected positions. While you might want to have that separation for, appointed jobs, I just wonder, shouldn't people be able to elect who they want?
Sure, thank you. I'm happy to answer the question again. So as I said, we have 29 professions, 29 colleges here in Alberta. And we have 6 examples where colleges and associations are the same. And we see the importance of making sure that the two bodies have play different roles. That the colleges are serving the interests of the public and patient safety, and the associations are serving their members as and serving the interests of the profession and advocating for the profession. So the two different roles that they need to play. This was a request that started with our conversations with CARNA, the College of the Registered Nurses. And to have that separation, there has to be at some point an opportunity for us to define where one ends and one begins. So that's the motive behind this, and it really started with the conversations we had last year with the College of the Registered Nurses.
Thanks. Follow-up?
No, I just want to touch on, shouldn't people be able to vote for who they want to for elected positions?
Well, they can continue to vote for who they want. I mean, I use as an example in my speaking notes the AMA. We have section heads in the AMA who are voted in as a section head for that particular section, who serve on the council of the College of Physicians and Surgeons. So absolutely that can happen.
Right. Thanks, Ashley. We'll move to the next question.
Our next question comes from Tim Burt of CTV. Your line is open.
Hey, thanks for taking my call. I just wanted to maybe ask about something a little different. More protests happening today in Calgary outside the Sheldon Schumer and Foothills. I just wanted to get your take on it. I know this has been framed in the past as somewhat of a government versus union issue, but it seems like a lot more people in these rallies now are not affiliated with the union. So I'd just love to get your take on that.
Yeah, I understand that there are rallies to support healthcare workers, and I thank all Albertans, especially in the middle of this pandemic, for supporting our healthcare workers. They're under enormous pressure, and my thanks goes out to all of those who are throughout the health system, in particular in our acute care facilities and our continuing care facilities, for all the work that they're doing, and the enormous pressure that they're feeling right now. Throughout the system, and everything they're doing for patients and continuing care for residents. So my thanks goes out to those healthcare workers.
Follow-up, Tim?
Yeah, a lot of those healthcare workers are unhappy with some of the proposed changes over the last year and a half over what they believe is coming regarding privatization. I'd love to get your opinion on that as well. What do you say to the people, again, that are worried about privatization, that are worried about healthcare cuts, that are worried about job losses?
Well, contracting out isn't privatization. I mean, that's just not true. Contracting out in the health system is something that has happened for years and years and years. It's happened under the NDP. For example, the NDP had 80% of our beds in continuing care contracted out. 70% of our community labs in north of Red Deer contracted out. 68% of our laundry under the NDP contracted out to in Calgary and Edmonton. Contracting out is still publicly paid for by the taxpayers. So it's not privatization. We're going to continue to make sure that AHS is focusing on patient care. And I think the recommendations of EY in their performance review throughout 2019 highlighted that we can be more efficient in AHS's operations, so that we have the ability to spend more on patient care. And that's exactly why we're supporting AHS in this careful and quite frankly, because of the pandemic, scaled back proposals that came forward to us. We've asked AHS to proceed carefully and with only a portion of the plan. But these portions of the plan are also going to take years to implement. That will come well after the pandemic. And we're going to continue to work with AHS to make sure they're more efficient.
Thanks, Tim. We'll go to the next question.
Our next question comes from Nicole Stilger of Global News. Your line is open.
Hi there, Health Minister. Thank you so much for taking my question. I have a question centered on restrictions. We've heard doctors in Edmonton say hospital care is at tipping point, saying entire units have had to close, hospital beds could soon be hard to come by. How close would we be to implementing new restrictions? Is there a threshold? And how close would we be to that?
Well, let me say this. Same as I said yesterday, my thanks goes to all of the healthcare workers, including our physicians and nurses in our acute care facilities. Yes, we are feeling capacity strains in Calgary and Edmonton in our acute care facilities there because of the increased cases. And so thank you to them. Of course, as a government, we are concerned about the rising numbers and what that will mean for the strain in our hospital capacity, especially in Edmonton and Calgary. For further measures, like as I said many times throughout the pandemic, that we have to make sure that the measures, we're going to first of all wait for the advice of our public health officials, Dr. Dina Hinshaw, as well as the other officials in her office, the senior medical officer of health in NHS. We rely on their expertise and their recommendations, but the measures that we will be imposing in Alberta are going to be narrow, they're going to be focused, they're going to be based on evidence, and we're going to do our best to minimize business disruption.
Thanks. Follow-up, and then we'll wrap up there.
No, thank you.
Okay.
Thank you.
Thanks very much, everyone. I think we covered the bill pretty fully, and it's a House day, so we're going to get Minister Shandro back to the legislature. Thanks. If there are follow-ups, you know how to reach me. Thanks.